بسم الله الرحمن الرحيم. أرحب بسعادتكم جميعا في لقائنا المستمر في برنامج التعليم الطبي المستمر لقسم الصحة العامة بكلية الطب جامعة بني سويف. ونتشرف اليوم بوجود دكتور محمد الحسن، الصديق والزميل الحبيب وعشرة الغربة في الولايات المتحدة الأمريكية. وكانت أحلى الأيام الحقيقة. يعني أنا طلبت الحقيقة من دكتور محمد بس يعني بصفته يعني متخصص في التعليم الطبي، إن هو يتكلم معانا على ال constructions of multiple choice questions بسبب الاتجاه العام حاليا في اختباراتنا كلها اعتمادا على هذا النوع من الأسئلة. الحقيقة وضع المالتيبل تشويس كويشن أو الأسئلة متعددة الاختيارات تحتاج إن احنا نلقي الضوء عليها. ومرة أخرى بتوجه بالشكر لصديقي وزميلي وحبيبي الدكتور محمد الحسن لقبوله الدعوة اللي وجهناها لي من القاهرة من كلية طب جامعة بني سويف كمان لمشاركتنا هذا اليوم. تفضل دكتور محمد.
شكرا جزيلا دكتور تامر، وأنا أتشرف بأنه أكون معاكم اليوم، وهي دعوة كريمة وكان الواحد لازم يلبيها بإذن الله من شخص كريم، يعني بحكم العلاقة القديمة اللي بيناتنا بإذن الله. اليوم إن شاء الله في خلال الساعة أو الساعة وربع الجايات إن شاء الله حنتكلم عن الرايتنج كواليتي MCQs زي ما ذكر تامر. إن شاء الله أنا حكون حنتكلم عنها، وإذا في أي questions أو أي حاجة ممكن نجاوب بإذن الله سبحانه وتعالى. طيب، التوجه الآن العام إنه الناس they use the MCQs for assessment, but we need to understand why do we need to assess students from the beginning? Because if we have this understanding, then we can use that understanding to develop the questions correctly. So we have many reasons to assess students, but the main two reasons to assess students are that by the end, we want to provide safe practitioners to the society. So it's our accountability to the society to provide them with good practitioners who have the competency and who are safe to practice. Also, at the same time, we want to ensure that the students whom we are progressing are competent. So those are the major two reasons for why we assess the students: for the accountability of the society and the fairness for the students. Then ideally, if we want to do this, we need to do the assessment after they finish the curriculum, because the competency are built up, and when they started the practice. This is ideally, but this is not practical. We cannot do this. We cannot wait until they finish the 6 years or until they finish all the curriculum and then we assess them. So practically, we do the assessment as per the curriculum plan, whether it's like the end of the year or end of the module or end of the course or end of the phase, depending on the curriculum plan. So to mix between the ideal situation and the practical situation, we need to mimic the real life situation as much as possible to ensure accountability. And we need to follow the rules of validity and reliability so we can discriminate between students who have the knowledge and students who do not have the knowledge. Those two principles of mimicking the real life situation as much as possible and follow the principles of validity and reliability to discriminate should be followed by all assessment methods. And the multiple choice questions is one of them. So we need to remember this while we are preparing all types of questions, whether it is multiple choice questions or not. So today we would like to discuss more on how can we apply those principles when we construct our multiple choice questions. By the end of this session, we have a short guide on how to construct multiple choice questions. It was developed earlier by me and my colleagues, and I'm going to, it is free online, and I'm going also to supply you with the link to download it. Okay, the golden rule in multiple choice question construction is that not all learning outcomes can be assessed by MCQs. That is why for the validity of the exam, we use multiple instruments. So we have the multiple choice questions, we have the other written questions, we have the clinical, we have the OSCE, we have maybe other types of questions. So all those questions will give us the achievement of the learning outcome by the student. So we need to make sure that our blueprint is well developed, so we determine what learning outcomes we are going to assess by multiple choice questions. And also we need to consider what type of multiple choice questions we are using. There are different types, and they have different names, usually alphabetical: A type, B type, C type, and until R type. From all those types, now there are two types which are alive, and people use them very much, which is the one best answer, and we call it the A type. And there is extended matching questions, which is the R type. The principles I'm going to talk about today can be applied into both types, but we are going to concentrate more on the A type today, and hopefully we can have another time to discuss the R type. There are other types of MCQs which are dead: K type, C type. Don't bother yourself. And there is a type which is used now, but it is sick and eventually may go to die, which is the true and false. But the thing that I want to mention here, among all the known types of multiple choice questions that we have, we do not have a type which is one single answer. Because if you see the one single answer, it is actually a true and false MCQs type with only one answer which is true. So you either make it true and false, the sick one, or you make it one best answer or extended matching questions, but you don't aim at one single answer, because this is not a recognized type of multiple choice questions. I assume that all people are going to choose whether the A type or the R type. Okay. Why do we use MCQs, the A type? Because we want to test higher level cognitive domains, and we want to discriminate between students, but this cannot happen unless it is well constructed. Because if the MCQs is not well constructed, it may test only recall of information or may test nothing. And the recall of the information, although it is needed at a level, but it is not needed at all levels, because the idea behind education is to store the knowledge and to retrieve the knowledge when needed. And when needed means the application of the knowledge. And remember, the two reasons behind assessment I mentioned in the beginning, that we want to be accountable to the community, that we are producing safe practitioners. Then we need someone who can apply the knowledge in real life situation. And as I mentioned, because we cannot wait until they graduate, so we mimic the real life situation as much as we can. So we need to mimic a situation where we can test the application or knowledge rather than the recall of knowledge. That is why we need to have an MCQs which is well constructed. So when we say to someone that you passed, you achieved the learning outcomes, that means you can apply that knowledge when needed later on, inshallah. Like, how do we construct it? The anatomy of the A type has the stem, which is a vignette, and the leading questions and the options. In the stem, you need to include as much information as possible. It should be relatively long and should contain no unwanted information. That is, each word or each phrase in the stem should be functional and can make the student or make the participant think about what is the possible option for the solution. Then you have the leading question, which should be a clear statement or a clear question. And I'm going to talk about it in a minute. Then we have the options. The options, usually they are 5. One of them is a key answer, and the others are distractors. The function of the distractors is to distract those who are not knowledgeable, those who do not achieve the learning outcome. So each one of them should distract at least, as I mentioned in the statistics of the MCQs, at least 5% of the students. Why is that? Because if you have distractors which are non-functional, so nobody can choose them, that means you are going to increase what they call the non-functional options, and this will reduce the reliability of the exam. So the more non-functional options you have, the less reliability of the exam you will have. Those options should be homogeneous and plausible. What does that mean? For example, if you ask about diagnosis, so all the options should be diagnoses. This is a homogeneity. Plausible, that means all the diagnoses that you put are related to the same body organ. If you are asking about a diagnosis in the GIT, so all the options should be as related to each other as much as possible. Because all the options must have some sort of correctness, but the right option will be the most likely correct. And this is why we call it best of 5, or the best answer. It is the best answer for this question because it is related to the STEM. How is that? If you have a question about a man who is 60 years old who suffers from GI bleeding, for example, lower GI bleeding. So the diagnosis may be cancer. So if you only change the 60 years to 6 years old boy, then the diagnosis may not be cancer, but maybe something else related to the GI bleeding. So it is best answer related to this stem. And if we change a little in the stem, the answer could be the other options, could be E or A or C or D. This is how we build the critical thinking among students based on the assessment. So we know that this student thought about the effect of age and in relation to the symptoms in order to reach the diagnosis. So if we change a little in the stem, then the option will be something else. That is why you need to put more effort when you develop or you construct your multiple choice questions. We have two types of MCQs, A type, that we can provide to students. We have what we call the context-free questions, or we have the context-rich questions. The context-free questions is the question that is direct, like this one. Thrombocytopenia results from deficiency of which blood component? 1, 2, 3 are A, B, C, D, E options. Yes, here in the context-free questions, I can judge that the student knows the reasons for thrombocytopenia. But in the context-rich questions, I can judge that the student can use that information in order to apply it when needed. And this is the aim of education. So when we have context-free questions, we usually test the lower knowledge or the lower level knowledge, level 1, which is the knowledge, comprehension, and mostly application. But if we have the context-rich questions, we test the application, synthesis, analysis, and evaluation levels of knowledge, which are higher level thinking skills. And that is what we are aiming at. We are not aiming at whether the students know the information or not, but more than that, we aim at whether the student can use the information or not. And we cannot do this unless we have well-constructed questions, whether it is MCQs or other type of questions. So to follow the golden rules in multiple choice questions, that each multiple choice question should focus on important objective or concept. And we make sure that this can be measured by multiple choice questions. What I mean by that, for example, if you want to ask about definition, the best type of questions to ask about definition definitely is not multiple choice questions, because there is no any synthesis that the student can make. So it is whether the students know or not, whether he knows the definition or he doesn't know it. So maybe you can choose other type of questions. Questions like matching may not be the best for multiple choice questions. So leave the multiple choice questions to the concepts and objectives that related to the application of knowledge. Because if you want to develop the options, you can develop options definitely that can test the critical thinking of the students. But for the definitions, for example, you will find difficulty in developing the options or the distractors, and you try to make it a little bit away from the original definition, and this may confuse the knowledgeable students. This is one of the problems in multiple choice question, is that if we do not construct it well, usually we confuse the knowledgeable students. We do not confuse those who are not knowledgeable. We need to avoid the technical flaws, and there are a list of flaws the research defined that we need to avoid, and I'm going to discuss them in a minute. You need to review the multiple choice questions before you present it to the students. In one of the research done, they found that the good multiple choice questions may need between 20 to 24 hours of development and review. But this is for maybe they did this in the National Board of Medical Examiners, where they use their multiple choice questions for the USMLE. This does not mean that we need to have quality of questions less than that quality, but we need to improve the quality to the level that we really test what is needed to be tested. So it will be valid instrument. It is well known in multiple choice questions that the good multiple choice question is the one that the student can answer, the knowledgeable students can answer without looking into the options. And they call this the cover test. So the first test that you can do to judge whether the multiple choice question is good one or not, you cover the options and you see whether you can answer it or not. If you can reach the answer directly, then it passed the test number one. If you cannot answer the question unless you see the options, this we call it failed the cover test, and then you need to review and revise that multiple choice questions. For example, the questions that say which of the following is something, is a definition of something. So I cannot answer these questions unless I see the options. So if your multiple choice questions fail the cover test, then you need to revise it. Why do we care about item constructions that it is free of flaws? As I mentioned, because the more flaws we have in the multiple choice questions, we either confuse the knowledgeable students, or we either let someone to get the right answer, not because he knows, but because he knows what are the problems in the MCQs, and then this will affect the fairness. This will affect the other reason for why do we assess the students that I have discussed in the beginning, that the accountability and the fairness. Because when we have the results at the end, we need to make sure that we are discriminating between those who knows and those who doesn't know. That is why when we see the flaws, we have two types of flaws. We have two types of problems in the MCQs that we need to avoid. The first section, which we call it the Test Wiseness, those are the flaws that can help the student whom they doesn't know to get the right answer, like the grammatical cues. If someone have good English language, they may reach the right answer if we do not construct the question well. For example, someone who asks about two reasons, for example, and then in the options, you find three of the options are not in plural terms. They don't have the S. So if I know English well, then I can just remove those options out and I will work with two options that I have. Or the logical cues, so that options doesn't go logically with the question. As I mentioned, for example, you ask about a question that related to the GIT organ, and then you ask about the diagnosis, and one of the diagnoses that you put in the options are related to the cardiopulmonary. Then I can just remove it out. So the options here will not be functional. There is a common mistake that we do, that we repeat the word, a keyword in the stem, we repeat it the same in the options. So logically, people may go with it, and most probably it is the right answer. Long option is the correct. This is a common mistake that we do. Why is that? Because we as teachers, psychologically, we want our student to pass. So without any intention from our side, we tend to write the right option with all the information that is needed. And then we write the distractors. So you find yourself as a teacher, you put all the information in the long option, and that you make it the long one, or the long option, which is the correct. The use of the absolute terms. There is nothing absolute in medicine. So when people find words like definitely, absolutely, usually they tend to take it out of the options. They don't think about it. So this is not because they know, but because they know there is a rule in medicine that there is nothing absolute. Or the implausible distractors, as I mentioned before. There is one type of the flows that we call it the convergence, where you have option A, option B, and then you find option C, which contains A and B together. So most probably this is the right one. And if it is not the right one, this will give you a challenge when marking, because there is part of the right answer is there. So avoid the convergence as much as possible. And then the common two flows, that all of the above or none of the above. What is the problems between in all of the above and none of the above? If you put all of the above, then the student needs to put effort in two options. If they are right, I will not see the other two options. I will go directly to all of the above. So you increase the number of non-functional options, and you reduce the reliability of your assessment. In none of the above, the opposite. If I recognize that two of the options are not right, then the right answer is none of the above. But there is a problem more than this. By none of the above, you test nothing, because you know that the student know that the options that you mention are not the right thing, but you cannot judge that he knows the right answer. In a simple example, if you ask someone about my name and you give options like Ali, Ahmed, Mahmoud, Hassan, and none of the above, and the student chose none of the above, he is right, but you cannot judge that he knows my name is Mohamed Hassan. So these are the questions that test nothing in the assessment, and it will be on expense of the validity and reliability of your assessment. So these are the flaws which we call it the test wiseness, that the flaws that help students to get marks, not because they know the learning outcome or they achieve the learning outcome, but because we did the multiple choice questions. There are other flaws which we call it irrelevant difficulty. So
يا دكتور تامر انت ميوت المحاضر، معلش ممكن تخليه يشتغل، هو كده هو ميوت، احنا مش سامعين حاجه.
طيب السلام عليكم. انا now is unmuted. ف which is the last word that you listen to?
اللي هم none of the above وهم كلهم مش فاهمين.
That's fine. تمام. اوكي طيب نمشي لل other types of the technical flaws, which is irrelevant difficulty. An irrelevant difficulty that when we add difficulty to the questions, that is not needed. The problem with the irrelevant difficulty is that usually it affects those who knows, those who are knowledgeable. لأنه حيبدوا to think about what do they mean, what does the teacher mean by this, and they may start think about things which are totally irrelevant, and they may get the answer wrong. Like when we use the vague terms or terms that are not well understood, or when we have poor sequence of numerical data. So usually if you have a data that you want, numerical that you want to include in the options, better to put it in a sequence, either from the smallest to the highest or from the highest to the smallest. Or when we add unnecessary information, especially in the stem. When you use unnecessary information, as I mentioned, that it will make the knowledgeable student think about what does the teacher mean by this. The other thing, it will increase what we call the reading time. So the students will take more time in reading the question, and this will affect their time for the other questions, and the ultimate result is reducing the reliability of the exam. Because the exam reliability, one of the factors that affect the reliability is the time given to each question. So when you add unnecessary information, you increase the reading time, and this will reduce the reliability. One of the irrelevant flaws when you use unclear or ambiguous information. Remember, the student, while sitting the exam, they are in a stress situation. So we don't need to add to the stress, because we all know that stress has a threshold. If it increases or if it exceeds that threshold, it will become a negative thing. So when we add unclear or ambiguous information, then we add to the stress, and then we reduce their ability to get the right answer. This is the same when you, by mistake, for example, you put more than one correct answer, or you put no correct answer in the options. This usually is done by mistake. That is why we mentioned in the beginning that it is healthy that you have someone to revise the questions before it goes to the students. Fail of the hand cover test, I talk about it, that you need to make sure that the question can be answered without looking into the options. One of the things that gives the multiple choice questions irrelevant difficulty is the use of negative, like not and except. What is the problem in that? There are two problems here. The first one is that we usually teach students the positive thing. We usually tell them that the causes of A are 1, 2, 3, 4, and 5. So why do we ask about the opposite? As if we are testing the opposite of what we are teaching. The other thing, that the brain usually has a momentum when answering the questions. So when you have a negative question or accept questions, that means the brain needs to change its momentum suddenly. And here I said in Arabic, زي العربية لما تكون ماشية بسرعة وتاخد دورة بيحصل على شنو؟ بتتقلب. The same happened in the brain. So unless there is a need for using the negative stems, don't use it. And the use of the negative stems are needed in very few areas. Maybe the contraindications, for example, or sometimes the complications. But all in all, try to avoid the negative as much as you can. And if there is a need to use the except questions, then the rule is that you need to have it in bold. So the word except or the word not, you have to have it in bold and you have to have it underlined so the students can recognize from the beginning, you know, there is something here that I need to take care of. And if the except questions are easy to construct, but again, it will not give you the idea about the achievement of the learning outcomes. Because if you ask about causes except, so you don't know whether he know all the causes or not, you cannot judge, you know, that he knows that this chosen item or this chosen answer is not the cause because of 1, 2, 3, 4, and 5. And that is what is needed from the student. It is not about just recall. So at the end, you find the except questions or the negative questions, it tests only recall of information and it doesn't test any application of knowledge. So these are the flaws that you need to cater for when you are constructing your multiple choice question for each one. So you make it as a checklist and you go one by one with it. If they are all okay, then your multiple choice questions is okay. If there is anything that needs to be corrected, then do it before you have your questions to the students. And if you do it many times, by time it will be habit and you will develop the skill of developing the questions. In the vignette or the stem, as we mentioned, that you need to have as much information that is needed as possible. So you can write general information about the patient or the problem if you are not addressing a patient. Information about the context, because the context will determine the right answer. As I mentioned in the example, I mentioned in the beginning that if the age is 60, then the right answer is B, for example. But if the age is 6, then the answer will be something else. So we need to write about the context, the complaint, if you are, or the main problem, duration of time, because we know that most of the things that we have in medicine relate to the time, duration. And if there are any other relative information. Don't add more information that are not needed, because I repeat, it will increase the reading time, it will confuse the knowledgeable students, and will make your assessment reliability low. So make sure that you put the needed information, not more, not less. Then there is always a question about, for the leading question, whether it is a question is a question mark or it can be a statement that when you put the option with it, it completes a sentence. There is no hard or fast rule in this. You can use the question or you can use the statement. But it is important that each college, each faculty, each department to have their in-house style of the multiple choice questions. So if you agree on that the leading question should be a question with a question mark, so all the questions should be like that. Or if you use the statement, all the multiple choice questions should be like that. Again, because this may confuse the students inside the exam. And the last thing that we want to do is to confuse our students while they are doing their exams, and that we have results that cannot reflect our work all through the year. When you develop your options, you start writing the key answer first. And that is why I mentioned in the beginning, when I talk about the flows, that usually the right answer, we make it the longest one. So we write the key answer first, and then we write the distractors. When the first, the second, the third, till we finish. One of the things that happen here usually, they discover that people usually tend to put the right answer as number C. So you write the correct answer, number C, and then you write 2 options above and 2 options below. So the students now, they knew that if you are going to guess, choose number C. So again, this is one of the things that you need to consider when you put your right answer, that you move it from A to B to C to be equally distributed among your questions in the exam. How many options do we have? Is it 5? Why and why not? There is no rule behind the 5. The 5, it is a habit that we have from the National Board of Medical Examiner, where the A-type first developed there. You can use 4 options, and there are a lot of research says that 4 options are better than 5 options because it reduces the non-functional options. Usually it is very difficult to have a 5th option. You can write the first option, which is right, the key answer. Distractor 1, distractor 2 will be a little bit difficult. Distractor 3 will be more difficult. The final distractor or the last distractor will be very difficult to have. So most of the time we have at least 1 non-functional option in our questions. So there is a body of research which says that you can use 4 options, but whether you have 4 or 5, you need to be consistent. So the in-house style of the exam, you either agree on having 5 altogether, or you have 4 altogether. Sometimes they say, if you want to have few questions with 4 options, then you need to put them at the end, and you give the students clear instructions that questions from 20 to 25, they have 4 options only. Again, we don't need to increase the stress. We don't want to put our students in stress that there is an option here which is missed, and this is the option that is the right one. And then the faculty member or the teacher is going to cater for this. So whether you choose 4 or 5, it's okay, but you need to be consistent. Okay, these are the common flaws that I can talk about. I have some examples where we can work on what are the flaws. But before that, if you have any question you want to ask, I will be happy to answer, and then we can move to the examples that I have.
Dr. Mohamed?
Yes.
most of
raise hand عشان ننظم بس الأسئلة. دكتورة منى اتفضلي حضرتك.
Thank you very much for your very elegant presentation, Dr. Mohamed Al-Hassan. I am a professor of internal medicine at the Faculty of Medicine, Alexandria University. So I just wanted to clarify, please, if you may explain again the part about convergence of in the flows. I didn't understand that well. Thank you very much.
Okay. For example, you have 5 options. So in option 1, the answer is A. You write A. Option 2, you write B. Option C or option 3, you write A and B. So this we call it convergence, because they are either this is the right one because it contains both options, or there is part of the right answer is in that option. For example, if you mean that you intend that the right option will be number 1. So number 3 has part of the right option. So if I choose it, are you going to give me half mark, or you will give me wrong answer? So each option, the idea behind the convergence that each option should stand by itself. It should not contain part of the other option narration. Is that okay?
Okay. Okay. Yes. Thank you very much.
Thank you.
دكتورة فاطمة اتفضلي حضرتك وبعد كده دكتور ياسر الوصيفي.
Good evening, doctor. Thanks for
دكتورة
the
فاطمة
great
سيد.
presentation. Hello, do you hear me?
Yes, we can hear you.
Okay. My question is about putting the STEM question in the form of a statement. It is like complete form, right?
Yes.
Question is, do you think that putting the STEM question as a statement fulfills the cover test?
Yes, it can cover it, but I give you my personal experience. It's very difficult to have a logical, complete sentence between the question, which is the statement, and the 5 options. So you need to put more effort in order to have the cover test fulfilled and to have the logical flow of the sentence fulfilled. So if you want my opinion, make it a question with full stop. But I'm giving you all the options that you may find in the literature, and then you will have the options to choose. But the easiest way is to make it as a question with a clear question mark at the end.
Yeah, thank you, sir. I have a second question, please. Is there a suggested number of words for the case scenario, the STEM and the STEM of the case scenario questions?
No, there is no suggested words, but there is a suggested time for the multiple choice question. All in all, they found that usually the good multiple choice questions with the average students, it needs between minutes to 1.5 minutes to be completed, so the one can read it and then can think about the answer and choose the right answer. That is why I mentioned if we add more unnecessary words to the STEM, then we are going to compromise those 1 minute or 1 minute and a half, and we will affect the response to the other questions. And you know your students well, definitely. Sometimes in the beginning of the years, year 1, year 2, you may give shorter stems, but usually when you go to final years, because the context should be rich at that time, and the clinical sense that need to be tested will be more, or the critical thinking will be more. So you may need to increase in the STEM, but there is no definite number of words that you can that is suggested.
Okay, last question. I'm sorry. The last question is sometimes.
فاطمة هستأذن حضرتك عشان بس ندي فرصة لل our other participants، وممكن السؤال ده نرجع فيه بإذن الله. أشكرك يا فندم. دكتور ياسر followed by دكتورة حنان followed by دكتور بروفيسور عبد العزيز. اتفضل دكتور ياسر.
شكرا. السلام عليكم. شكرا دكتور تامر على الدعوة الكريمة. شكرا دكتور محمد الحسن. فرصة عظيمة ان انا اقابل حضرتك، يعني قريت لحضرتك شغل كتير، يعني فرصة ما كانتش تتعوض. عندي استفسار بسيط بعد اذن حضرتك. You mentioned that ان انا اقدر في الديستراكتورز اخليهم 5 أو 4 يعني to be mixed in the same exam، بس ان انا اخليهم في جروب لوحدهم. تمام؟
Yes.
اوكي. ونوتيفاي او انستراكت للستودنتس بستيتمنت واضحه ان هذا البارت كذا. سؤالي عن الاكزام سايكومتريك اناليسيز. اوكي. لما يبقى في جزء 4 ديستراكتورز وجزء 5 ديستراكتورز does it affect الفاينل analysis post exam analysis or you prefer to analyze each part separately?
لا, it will not affect usually because in the system the psychometric analysis at last is something that you provide or the information. So you tell the system that you have questions which are 4, and then the only thing that is can be affected, which is the number of non-functioning options. And if you have the all exams are 4 as 4 options, then you make the system from the beginning know that you have 4 options and it will not affect. If you have like 4, 5 questions, 10 questions, it will not affect the psychometric analysis, because the effect of the non-functioning options, if it is only one option, it is not that big. So the reliability will not be reduced to so much. And you can depend on the KR21 to find out the reliability, and this will not affect your psychometric at all.
دكتور محمد احنا ممكن نرتب بعد كده يعني another meeting for the post test item analysis او post hoc test item analysis بحيث ان احنا الموضوع الحقيقي extremely important to analyze our exams and our MCQs later on.
معانا انا اقول لك دايما بقول لهم انه if you are doing multiple choice questions exams and you don't have post item analysis, that means you are not doing the proper way of testing your students.
هو الكونسبت احنا عايزين نوصله، فاحنا باذن الله ان شاء الله نثقل عليك مره اخرى في البوست هوك تيست ايتم اناليسيز، يعني انت اللي بتجيب لروحك ان شاء الله. ما في طيب معانا دكتوره حنان وبعدين بروف عبد العزيز وبعدين دكتوره سبا وبعدين نبدا الاكزامبلز عشان ما ناخدش وقت اكتر من كده.
خير ان شاء الله.
السلام عليكم. هي ملحوظه صغيره.
دكتوره حنان
السلام عليكم.
اتفضلي.
طبعا بشكر حضراتكم جدا. هو بس ملحوظه صغيره، الحقيقه معظم الكتب اللي في ايدينا اللي بنستعين بيها هي فيها بيست 5 كويستشنز. حضرتك قلت انه الاربعه افضل، وهو الحقيقه في تركيبه بيبقى اسهل، بس مش فاهمه ليه يعني ليه معظمه بيست 5 واللي معانا كتب قديمه فيها 4 غالبا مش بنستعين بيها.
هي best of 5 as I mentioned انه the people who invented a type of questions قالوا 5 لكن they don't have a rule behind this. Earlier كان they think each option may resemble 20%, but there is no any evidence behind this. But if I can send you some of the maybe later on some of the articles that tells when we have 4 options we have best psychometric analysis. لأنه non-functioning options بتقل. So it depends on you in the in-house style. If you depend on 5, make it 5. No issues. But if you want to make it 4, you can. But as I mentioned, there are precautions that you need to do.
تمام شكرا.
دكتورة عبد العزيز، بروف عبد العزيز، ودكتورة سبق بعد كده. دكتور عبد العزيز نزل ايده. طيب دكتورة سبق اتفضلي.
أولا thank you دكتور for this fabulous lecture. سؤالي كده يعني من خلال ملاحظتي إنه أحيانا بيكون في سيناريو بيتحط على الطلاب. السيناريو مثلا يتبعوا 5 أو 6 أسئلة 6 questions related to the same scenario. يعني from your experience is it fair on the student؟ يعني لو الطالب مثلا كان مجتهد في الحتة دي اللي فيها السيناريو كل الأسئلة دي ممكن يخسر كثير من الماركس، بيحصل discrepancies بين الستودنت. والسؤال الثاني اللي هو how many يعني المفروض scenarios allowed like such like this scenario in exam for example. إذا كان عندنا 40 سؤال أو 60 سؤال كم مسموح يكون معانا الستم اللي يكون طالع منه 6 أو 7 أسئلة أو 4 أسئلة؟ دي حاجة. كمان في ملاحظة إنه أحيانا بيتكتب الستم وبيلحقوا 4 أسئلة بس ما فيش instructions للطلاب إنه answer the following 4 or 5 questions relevant to this STEM مثلا. I need your answers to this.
Okay.
Please.
شكرا جزيلا for raising this point. أول حاجة الأصل إنه each multiple choice question should stand by itself. But sometimes we can have a question or a scenario that have a maximum of 3 options to use, or the 3 questions. يعني السيناريو الواحد يكون عليه 3 questions. Some people they said that it will increase the level of critical thinking. لأنه الآن مثلا في real life the patient إذا كان جاك patient في الهوسبيتال ممكن يعني we think about different things related to its condition. But if you add the questions to be 4 or 5, then you change the multiple choice questions into another format called modified essay question. And you mix between the modified essay questions and the multiple choice questions, and then as if you are producing a third type of questions which is not validated. So the maximum you can do 2 or 3. The other important things that you need to make sure that the answer of the first questions will not affect the answer of the second question. يعني إذا أنا جبت first question wrong, this will not lead to have the second question wrong. So you may not ask about, the first questions will be about diagnosis, and then the second questions will be the treatment of that diagnosis. So if I get the first one wrong, for sure I'm going to get the second one wrong. So this is not permitted because this is the modified essay question type. This is another different type of questions. So if you want to use it, if there is a need to use it, minimize it to the minimum, 1 or 2 sets, and the questions in each set will not exceed 3, and you make sure that the results of or the answers are not related, as if it is each question has its own. So you will be fair with the students.
شكرا دكتور محمد. احنا اكشولي قدامنا 15 دقيقة.
لا I have like
انا عايز ان احنا نستفيد
اوكي.
لا عايزين نستفيد بيهم في الاكزامبلز، واذا في برضو نفتح مجال للاسئله كده. واضح ان الموضوع يعني كبير، بس يعني هو الهدف مينلي ان احنا القاء الضوء، وان احنا يعني نجذب انتباه الحضور لاهميه الموضوع، لان ما شاء الله كلهم بروفيسورز واساتذه، ف they can يعني look more after this presentation ان شاء الله. ف احنا منتظرين الاكزامبلز، وبعد كده هيبقى في مجال للاسئله يعني باذن الله. اتفضل حضرتك.
Okay, this is the first question. in 1 minute, if you read it, or 1.5 minutes, what is the wrong with this question? Any response?
دكتورة أسماء رفعت.
ايوه انا شايفه
دكتورة
في
أسماء.
كميات بس ما فيش leading question، وبعدين الديستراكتورز في واحد قصير قوي يعني. ده اللي انا من وجهة نظري.
Yes, but I agree with you. You know, a length of the distractors should be more or less the same. The question is not clear because here they use the statement. But the most important, there is no relation between the stem and the questions. Yani, you can ask the question without having the stem. And this is a common thing that we do when we construct our MCQs. That we think that we have to have a story or we have to have a long stem. We need to have a functional stem. Each
دكتور
word.
ممكن أعلق؟
Yes.
أولا الستيم طويل، يعني أنا لو أدرس سنة أولى I have to look into consideration their English language is not that يعني الطلاب مش كلهم بنفس المستوى في الإنجليش، فالستيم نفسه طويل كثير يعني عشان يقرأ بعدين يحصل له دايجيشن للكلام اللي يقرأ اللي بياخد أكتر من 1 minute الموضوع.
Yes, I agree معاك إذا كنا بنتكلم عن year 1، لكن in general whether it's year 1, year 6, a postgraduate, we need to have a functional stem. You know, الآن if I remove all the words and I make this question as impossible outbreak, what will be the case definition? What the case definition should include? It will be the same, am I right? So these 1, 2, 3, 4, 5 lines are definitely non-functional stem. And the non-functional stem, it will increase the reading time, it will complicate life, and as I mentioned, most probably it will complicate things to the knowledgeable students. Those who doesn't know, ما فرق معهم, they may guess it. Then here, there is some sort of confusion. Clinical criteria, specification of time, place, and person. Clinical features, exposure. So there are some sort of confusion in the options. You need to make it clear. So the lesson we have from here, or the point we have from here, that we need to have a functional stem, a clear question, and options that are clear, and to greater extent, they have the same length. Okay, here.
It's a negative stem, which is incorrect.
Yes, negative stem. Agree with you.
Cover test.
This is number 1. It fails the cover test. And if you cover the options, you cannot answer the question. So whether such questions, whether it has a context or context-free or context-rich or whatever, if it fails the cover test, then the quality of the MCQs is questionable.
I think كمان ان الديستراكتورز كانت طويلة قوي.
Yes, يعني عندك في distractor almost 2 lines. يبقى انت عشان تفهم distractors itself, it needs time. That means انه هنا الreading time بتاعك هيكون more than what is needed for the multiple choice question.
it
اللي
is
بعده برضه
one
نيجاتيف.
برضه نيجاتيف.
negative. Mm.
commonly
Commonly, yes, absolute terms. يعني not commonly considered to be part of a pop. يعني الكتابة نفسها is a little bit confusing. يعني
And
what do
best
you mean
cover
by not
test.
commonly?
بس حضرتك
non-functioning
ممكن
non-functioning distractors.
Excuse me?
يعني حضرتك كنت قلت ان ممكن نستعمل النيجاتيف بس على مستوى قليل. انا لو حطيته مثلا ببولد عالي و يعني ببولد وباين وكابيتال، مش ممكن يستخدم ان شاء الله مثلا مره او مرتين في امتحان مثلا 40 50؟
ممكن if it is needed as I mentioned انه في بعض الاسئله في النهايه there is no one size fits all. There are some questions that are important to be asked and they are important to be asked in a negative way. But if you can ask a question in a positive way, it is better.
Yes.
If you are obligated to use the negative, as I mentioned, you know, bold and capital and that things. And usually, if you look into the high stake exams, if you look, for example, to the UCMLE exam, you can barely find negative question. That means in Nihna we can add 1-2 maximum per 100 questions.
Yes.
But you can justify it. Yani you in the question committee, construction committee or whatever, حسب الكوميتيز اللي عندكم في department, you can defend why do you want to use the negative question.
And this is the overlapping of the options.
Yes, thank you very much. This is very important because there is overlapping في a numerical data. When you say 0 to 10, then the other one should be 11 to 20. So the first one will be totally separate than the other one. Because 10% is here and here. 20 is here and here. This is, again, it yields some sort of the convergence that we talk about. And this is very confusing for the students, by the way.
No leading equation.
Yes, but it is a stem, يعني can be completed.
ومكتوب A وبعد كده number B مثلا فيها 2
يبقى by automatically by knowledge of English language I will exclude number B.
تمام. معلش انا كنت عايزه اسال حضرتك يا دكتور يعني الام سي كيو لو انا دايما بجيب leading question، هل مسموح لي اجيب اسئله برضو في الوسط as complete ولا هيبقى odd؟
لا it's odd.
لازم يبقى كله في leading question.
ما زي ما قلت لك انه في انت يعني ال easiest way انك انت تعمل الكويستشنز، لكن انتوا عندكم الان هاوس ستايل، يعني كله ديبارتمنت او كله كليه لازم عندها ان هاوس ستايل بتاع الاسسمنت. يا جماعه بس ريمبر انه الطالب ده وهو قاعد في الاكزام ان ستريس كونديشن ما بيستحمل اي تغيير.
تمام.
طيب كده نحن قلنا وي اكسكلود نمبر بي لانه فيها 2 ونحن هنا قلنا ا. طيب will it be if I want to make it a complete sentence, a biologically plausible hypothesis ولا a multivariate statistical model or a spot map or recommendation for public health action? Because of this I will choose D, a spot map. لأنها الوحيدة اللي بتمشي بتديها complete sentence. Am I right?
Yes. Yes, you are right.
Anna, even if I don't know who is Jon Snow, I can answer this question.
Excuse me. Regarding the previous questions,
Yes.
I think it is type 1 question, K1 question. Is it better to end this question by question mark?
Better.
Better.
Better, yes, better.
In spite of it is K1 question.
Yes, yes, yes.
حلو السؤال.
ايوه ايه المشكله؟
جرامر
leading
فورمات
comments.
حلو السؤال يا دكتور.
مش واضح.
لا الاكسبيرمنتال والكلينيكال
No, the question is a little bit ambiguous. The stem is not very clear. I think it's ambiguous.
Yes, if I'm going to rate it ممكن يكون one of the best questions من احنا قمنا عرضناهم الآن.
Yes, the best one because it's actually you have a leading question.
Yes.
Which type of the study?
With
If you are looking
some,
for yes, which type of the study you
with
have?
few corrections للSTEM, it will be a good question. This is the message here يا جماعة إنه when it reviewed by someone else the questions, it can figure out few things that may improve the quality of the question.
Bad cover test.
Yes.
No leading question.
No question.
No question.
No question.
But most importantly, this is the type of questions, Jama'a, is very difficult to assess by multiple choice questions because the features of cross-sectional study are multiple. So if the student here can choose only one, so you don't want the students to know only one of the feature, but you want the students to know all the features. So this is
multiple choices.
Well, this is multiple choice. You mean multiple
No,
questions?
No, it is not one answer choice. Multiple answers.
Multiple
answers.
Like check box.
Best answer. We need best answer.
Short answer
question. بنتكلم عن one best answer.
هندخل في convergence.
This type of questions يا جماعة, you use the other questions formats that are available to use it. يعني because here
الإجابة overlap.
Yes, you either ask if you have short answer questions or if you have essay questions, short essay questions. This is not the questions that are suitable for multiple choice questions, because if you ask, for example, 5 questions around the cross-sectional studies, that means you give the cross-sectional study a chunk in the assessment that will affect the other parts of the curriculum. Because in your blueprint, you choose the number of questions to each learning outcome based on the weight of that learning outcome. So if you ask 5 questions around the features, then how many questions are left for the other parts of the curriculum? So as I mentioned at the beginning, Jama'a, you need to make sure that the question or the area that you are going to touch by multiple choice questions, that it is suitable to be touched and it's suitable to be answered, asked for by multiple choice questions. So these are the examples that I have because I know I'm aware of the time. And if there are more questions, we can have in the 3 left areas. Tamer, the floor is yours. Tamer, can you hear me?
شكرا جزيلا دكتور محمد.
شكرا.
الموضوع الحقيقه موضوع كبير وصعب ان احنا ننهي هذا الموضوع في في اسئله كثيره طرح. انا يعني نبدا الى 3 أو 4 اسئله حاليا عشان احنا يعني حابين ان احنا نلتزم بوقتنا الساعه عشان ما نثقلش على الحضور الاخرى. وان شاء الله الاسبوع القادم احنا عندنا محاضره على ال validity and reliability of questionnaires والfactor analysis. And you are going plan again for another meeting with Dr. Mohamed يكلمنا فيه على ال extended matched questions احنا ما اتكلمناش عليها النهارده، وال post hoc test item analysis to evaluate the quality of our exam. دكتوره وفاء اتفضلي حضرتك، ودكتوره سبق بعد كده رفع ايدها. انا بيظهر عندي السيكونس بتاع الريكوستنج كويستشن. ودكتوره وفاء اتفضلي يا فندم.
شكرا جزيلا. انا كنت
دكتوره
رافعه
نجلاء
علشان اجاوب حاجه من الاسئله اللي فاتت الحقيقه.
طيب يا فندم.
السلام عليكم. شكرا جزيلا.
دكتوره العفو يا فندم. عندنا دكتوره سبق فولود باي دكتوره نجلاء فولود باي دكتور كاظم سيد شاكر. دكتوره سبق اتفضلي يا فندم.
دكتور just a follow question. هو I want to know how many يعني questions that we can use في ال MCQs اللي يعني يكون arrays from it more than 2 or 3 questions. يعني يكون عندنا مثلا how many questions with scenarios that has 3 or 4 questions. We are allowed how many to have in the exam?
There is no rule, but usually it is not more than 2 to 3, not more than this.
طب انا ممكن اسال سؤال قبل يعني معلش هتدخل دكتوره نجلاء. بالنسبه للبرسنتج اوف K1 and K2 questions اللي هي knowledge questions والcognitive questions, الايديال اكزام should contain a percent how يعني percent قد ايه من knowledge question ومن الاناليسيس او الK2 questions اللي هي cognitive questions؟ هل 60 40% مثلا؟
It depends on the level. في year 1 مثلا you can accept 60 40. في year 6 مثلا اذا كان عندك 6 year medical school or 5 year medical school في ال final years you may ال K1 may reach maximum 10 to 15%.
اوكي. طيب دكتوره نجلاء اتفضلي يا فندم.
ايوه السلام عليكم. بشكر حضرتك جدا للمحاضره الجميله السلسه البسيطه دي بس كان عندي استفسار بالنسبه للليفل بتاع الطلبه. يعني هل هو احنا كنا بنبتدي للسنه اولى مثلا بالتشوز ذا كوريكت انسر وبعد كده بنعلى بيهم سنجل بيست انسر، يعني الاولانيه بتبقى اجابه واحده صحيحه وبعد كده بنعلى بالاسئله ان هي لا ممكن يبقى في اكتر من اجابه صحيحه بس في مور اكيوريت. فهل ده كده اوكي ماشي معانا ولا ايه الموضوع بالظبط؟
هي انا زي ما I mentioned at the beginning انه scientifically there is no type which is called one correct. في true and false وفي one best answer. فال one correct هي actually true and false but انت you ask the students to mark only one والباقيات ديلك wrong. ف this is not a good way of testing the knowledge of students لأنه mostly it tests the knowledge الريكول K1 انت بيقولوها وفي rules مختلفة للdevelopments of true and false. عشان كده الآن مثلا الجامعات البريطانية بدأت تدخل like additional انه if you say no if you say false يقول لك why عشان يعرفوا انك فاهم مش حافظه بس. الحاجة الثانية المهمة نحن we need to raise the student standard rather than to نحن ننزل بالستاندرد. ف the questions, the multiple choice questions, A type, which is the best of 5 or best answer, can easily be tackled by year 1 students as far as they are trained on how to respond to them. My advice, try to avoid one single answer as much as possible, because it is true and false, and you need to follow other rules to develop it, which is now, as I mentioned, it's a dying type of question.
دكتور كاظم اتفضل يا فندم.
Thank you. Assalamu alaikum. Thank you very much for your very nice presentation. My question is that sometime when we make the question MCQ, the one of the distractor which we usually place very close to the key answer. Sometimes it is refused by the education department. They say that it is going to confuse the students. My question is that isn't it a good way of testing the knowledge of the good student if your one of the distractor is closer to the key answer?
Is it closer or it is the right answer?
No,
if
it
is not closer, it's okay, no problem.
It is not the right answer.
If it is closer, it is okay, no problem.
Okay, that's
again يا جماعه احنا we don't need في notion عندنا انه نحن we need to have 30% for the non-knowledgeable و 30% for the middle knowledge and 30% or 40% for the knowledgeable students. This is we need to get rid of this, because our aim انه كل طلابنا to be knowledgeable. So if it is close, Dr. Kazim, it is okay. But if it is a right answer, so it is not okay.
No, it is definitely wrong, but it is closer to the yes. Thank you so much. Thank you.
No, it's okay.
Okay,
it depends on the level of the students, definitely.
Thank you.
شكرا دكتور محمد. في دكتور بروف عز زيدان، يعني اخر سؤال هناخده. بروف عز زيدان اتفضل يا فندم.
يا تامر، يا دكتور تامر، رافع صباعي من بدري. هي يعني
صباعك مش ظاهر عندي والله يا دكتور ايمان.
ايه ده؟ اعمل ايه؟ اعمل ايه؟ اتخانق معاك ولا اعمل ايه؟ طب بصي يا دكتور،
اتفضلي يا دكتوره ايمان.
يعني حقيقي المحاضره لطيفه جدا للناس اللي هي تقدر تكونستراكت كويشنير وتعمل كويشنير MCQ. انا من نفسي من الحاجات الصعبه على قلبي موضوع MCQ ده جدا. انا من الاولد سكول بتاعت ان احنا نكتب ونشوف الطالب عارف ايه وفاهم ايه. خلاص، بس انا بسال حضرتك بقى سؤال تاني خالص. انا ساعات بجيب كتب فيها الماده بتاعتي وبجيب منها كتب MCQ وباخد الاسئله وبحور فيها سنه بسيطه يعني علشان تمشي على المنهج اللي احنا بنقوله. هو ده صح ولا غلط؟ انا ما بقيمش السؤال بصراحه، يعني حقيقه بشوف السؤال ده انا قلته فباخده، ما قلتوش ما باخدوش. فانا مش عارفه ده صح ولا غلط، لان انا اساسا ما عنديش هذه الابيليتي ان انا الف سؤال.
طيب هو انا cannot say يعني I can say صح وغلط. صح وغلط why is that? Because الناس اللي بتعمل الكتب بتاعت MCQs بيكون همهم to direct your attention لل areas that you need to consider in your reading. ما بيكون همهم ال quality of the exam educationally، لأنه ال question فيه two parts، فيه شقين. شق educational إنه how to construct the question in a way that it can test something، وفيه شق تاني اللي هو based على ال content expertise بتاعت الناس.
امال اللي بيشتغلوا يا دكتور بنوك الاسئله دول بيعملوا بيها ايه؟ اصل ده بص ده ديبيت جامد قوي. هم عايزين يشتروا بنك اسئله وانا مش فاهمه، فانا عايزه اسال حضرتك.
بنك الاسئله برضه ديبيندز. يوجوالي في بنوك اسئله الاسئله فيها ويل كونستراكتد لانه ده بزنس. يعني يعني مثلا في بنوك اسئله انا I don't want to mention any of them، لكن في بنوك اسئله القائمين عليها educationist محترمين، يعني بيمسكوا السؤال بيفلفلوه فلفله محترمه عشان يكون at a high level لانه بزنس. وبرضه الديبنس انك انت والله.
طيب دكتور اعطينا احنا ريفرنسز لو سمحت.
يعني it can be a debate later on يعني.
هل ممكن اقول سؤال؟
تامر
مين حضرتك؟ دكتور
عزة زيدان.
اهلا يا دكتوره عزه، اتفضلي يا فندم. احنا قلنا احنا وجهنا لحضرتك الدعوه بس حضرتك ما سمعتناش. اتفضلي يا فندم.
أولا thank you very much for your lecture. My question is about the time of each of MCQ question. What's supposed to be?
1 minute to one and a half.
Okay, thank you.
Camera, and I'm trying to.
طيب دكتوره سهير، ده اخر سؤال. محمد هنستاذنك تعرضي على لانه مش هيظهر للكل على الشات بوكس.
ارسل لك على الواتساب ولا؟
اخر سؤال بروف سهير، اتفضلي يا فندم. واتساب او انا يعني هحاول اوصله لجميع الحضور عن طريق الفيسبوك اكونت او عن طريق الجروبس اللي انا اعلنت عليها.
تمام.
او الواتساب لهم رقم تليفون.
ما في اشكال. اوكي.
بروف سهير فندم، اخر سؤال. بروف سهير حضرتك، وتفضلي السؤال اللي احنا مش سامعين حضرتك.
خرجت يا تاني.
طيب في النهايه اتوجه بخالص شكري وتقديري لزميلي وصديقي الحبيب دكتور محمد. احنا في انتظار كوبي من المحاضره بتاعتك، ومنتظر اللينك للكتيب اللي انت يعني اشرت ليه في بدايه المحاضره لمشاركته مع جميع الحضور.
ان شاء الله.
شكرا لسعادتك. ليله سعيده.
عايزين بنك الاسئله يا دكتور محمد، عايزين بنك الاسئله بتاعك. ايوه انا قلت لك هي هستلف الاسئله.
تدفعي يا دكتور ايمان عشان تاخدي بنك الاسئله. هو بيزنس.